5 minutes after 11 o'clock. Beautiful Wednesday. Hope you're doing well. And if you're not doing well, why not? Why don't you get well? This is the Head to Toe Care Show, and that's what the show is all about. It's about getting well. Dr. Riadh Fakhoury is in the studio ready to answer your questions. The phone number you'll need to call is area code 352-622-9622. That is the WOCA Climate Control Source Hotline, 352-622-WOCA. Dr. Fakhoury is a chiropractic orthopedist and the owner of Fakhoury Medical and Chiropractic Center right here in Ocala. His address is 1009 Southwest 16th Lane, and the phone number at his office is 352-351-3413. Remember, I'm giving you a lot of numbers. You can always call here at the radio station. We'll be glad to repeat those numbers for you slowly over the phone, but right now, on January 23rd, 2013, Dr. Fakhoury is here. Good morning, Doctor.
Hey, good morning, Larry.
Yeah, just make sure. I know we've got some long-distance listeners today.
Okay.
A friend of mine up in New York had a question for you, and I'll present it to you.
Okay.
How's everything?
You know, everything's fantastic, thank you. Everything's great. A little chilly this morning, but the sun is coming out, and we're going to be more comfortable.
So I guess I'll just jump right into it.
Go ahead. Go ahead.
She has a tumor in her lower back.
Okay.
She first told me that. I said, "Oh no, that's not good." She said, "Well, it's not cancerous, but it's painful." Is there anything? And I don't know the surgery part. So if she's listening and she wants to call in, fill in the blanks because I don't know all the questions. But the one question she has is: there anything that a chiropractor could do to alleviate the pain? Because I guess the painkillers they're giving her isn't doing it.
Very interesting. It is. It's a good question, a very good question, but it's also general and vague. So what I'll do is I'll sort of touch a few points on that and talk about a tumor. Tumor is a mass, and it could be a dangerous thing, or it could be just an aggravation, or it might be a mass that just is there and has been there for years, and she never noticed it. But let's say that it's there's different types of tumors. Let's say that it's something called a lipoma, which is a fatty tumor, and basically a tumor made out of fat cells. It's not dangerous. You've seen it on people, you know, that you see a little bump on their back, and they say, "Oh, don't worry about that. That's just a fatty tumor," and that's a lipoma. And that will not cause any problems. People might notice it and see it, but it's not dangerous at all. In fact, we all have lipomas on either side of our sacroiliac, right below our spine, on the left and the right. If you feel there, you'll feel like a little nodular area, and that's a lipoma over our sacroiliac to protect us. So if we're sitting up against a chair, we have that fat to protect us from the sacroiliac joint rubbing against the chair or the object. Now, a lipoma will not cause any problems until it gets large enough that it starts putting pressure on things, and that is now it's becoming space occupying. There's a limited space, and it's starting to grow and put pressure on a tendon, on a nerve, and on a muscle, and that can cause pain. For example, in the wrist, people will have cysts or fluid-filled sacs, and you can feel them sometimes, little nodular areas, little round circular areas, and they won't cause any problems until they get large enough that they start rubbing, causing the pressure on the tendon. The tendon rubs on them, and then it becomes painful and can cause a tendinitis. So in this scenario, since it's a tumor but is not an urgent situation, it's probably a lipoma, and it's probably grown large enough to start putting pressure on structures, muscles, nerves, ligaments, to cause pain and discomfort. The usual course of treatment for that is removal. They'll remove the lipoma. The downside is the lipoma usually grows back again. So most likely that's what we're dealing with. There's also other types of tumors. There's so many different types of tumors where there is it's a multiple growth of a type of a cell that's causing this mass, which is what we call a tumor.
Okay, and I don't know the rest of the story. I don't know if she's considered having it surgically removed or not. That's the part I probably should have inquired about.
Yeah, and lipomas, we usually try to avoid surgical removal as long as possible.
Well, maybe that's what her doctor said.
And her question is, can an adjustment help?
Yes.
And so let's say, I think it was putting pressure on the muscle. So let's say that if a muscle is tight, it will put more pressure on that lipoma. So if we do a light massage and relax the muscle, that may help give relief. Sometimes those lipomas will swell up and become inflamed. So if we do some ultrasound and reduce the inflammation, that can cause some relief. Sometimes if there's a misalignment of a structure in the body, it could be a joint in the wrist, a bone in the wrist, it could be a vertebrae. So that's bringing structures close to that lipoma. So a manipulation or realignment into more of a normal position might be just enough to move it a few millimeters away and give relief for that individual. So can we help? Yes. Because sometimes the cysts, the tumors, they do get inflamed, or the capsules around them get inflamed, and if we can calm that down or take structures away from them, we can allow some relief. Do we get rid of the tumor? No. But we can just improve the function and help with the comfort.
I think one thing that's probably happened for a lot of people with the regular visits that you pay us on the radio is that we've come to realize that when it comes to pain, there is I don't know if you call what you do alternative, but a lot of times people don't think in terms of going to a chiropractor to alleviate pain. And we do have a phone call, but I think that's maybe what's finally making its way to the general population. You got a pain, you don't have to go through surgery or some kind of a extreme medicine.
Right.
Some kind of chiropractic care could alleviate it. We do have a phone call. Let's go to the phone. Good morning. You're on the air with Dr. Fakhoury.
Good morning, Larry. Good morning, Dr. Fakhoury. This is June. I have a question for you again.
Yes, ma'am. Good morning, June.
How are you, Doctor?
Very well. And you?
I'm doing much better, thank you, with your help.
Thank you, dear.
But I have a new question for you.
Yes, ma'am.
I noticed lately, in the last couple of days, when I get up out of bed, I have a neuralgia that goes across the top of my head like an electrical shock pain. And I'm wondering if a neck adjustment would help that, or is that related to something else? And I'll just hang up and listen to you. If you think I should come in for an adjustment for that, I will do it.
Quick question, June. Is it from the neck shooting up into the head, or the head shooting down?
It starts around the middle of the right side of my head on the top, and it goes down across my cap of my skull, like where the trigeminal nerve is. It doesn't go down below my eye. It doesn't go down into my jaw or anything like that. It's just, and it's gone within maybe 6 or 7 seconds, and it usually happens twice, and then it's over with for some reason or other. It's very odd.
I see. Okay, we'll
I'll just hang up and listen to you.
Thank you, June. So in that scenario that Ms. June is talking about, a sharp electrical type pain, and she used the word neuralgia, which is an excellent word, and algia means pain, neuro means nerve, so a nerve pain, and nerve pain can be dull, achy, sharp, stingy. There's different types of sensation, and people feel pain differently also. So since it starts mid skull and then shoots down, it could be several things. It could be simply a muscle spasm in the skull, because the skull has muscles surrounding it, and people don't realize that those muscles can contract and cause contraction type pain. And there are nerves in there also, so when that muscle contracts, it can trap a nerve and cause that type of shooting pain. I don't think it's anything scary, I don't think it's anything dangerous, and I think it could be taken care of very easily, because to me it sounds like it's a neuromuscular component where the nerve is getting trapped in between the muscles as the muscles are contracting, and it's shooting the pain. And she also used the word a trigeminal type pain, because there is a trigeminal nerve that pierces and can cause pain itself also, and that's known as trigeminal neuralgia, which is an extremely sharp, stabbing, piercing type pain, which can cover the scalp and cover the face. So we may either be dealing with a muscular contraction type problem on the skull that's radiating the pain towards the jaw area or the eye area. And because the trigeminal nerve, they call it tri because it has 3 parts. One that goes to the eye, one that goes to the mandible, or right across from the lip, and then also the jaw portion that goes down into the jaw. So it could be the upper part of the trigeminal neuralgia, that neuralgic nerve that's irritated, causing pain, and it could be perceived as coming from top to bottom, but it might be from bottom to top. So June, a good idea to come in and let's let Dr. Teeter or myself and Dr. Joe take a look and find out if it's a contraction, muscular contraction type pain in the scalp, or if it might be a trigeminal nerve that's being irritated. One of the branches, the top branch, or maybe it's the temporalis muscle. The temporalis muscle is a fan-like muscle that starts right behind, right about the jaw area, and then it spreads and fans out from the temple to the back of the head. So if you put your hand on the side of your ear and your fingers up and just lay your hand against your skull, then with your palm right about where your jaw is, that's where the trigeminal nerve, the temporalis musculature is. So it could be just a spasm of the temporal muscle, which is connected to the masseter muscle or the TMJ in jaw. So something that should be very easily and readily taken care of, because it's more, I believe, more of a muscular component. But thank you for that question. It's an excellent question.
In asking you the question, she used the word electrical. So that's how she was describing the way I felt.
Yes.
So from your perspective, our relationship with you, our ability to communicate with you, I mean, you've got to be able to understand, like, everybody must have a different meaning. Like, if I say electrical, might be different than what she's, you know what I mean?
But she was very cued in, because she said
much, yeah.
electrical, and she said neuralgia. So she knows that there's different types of pains with different structures in the body, and when the nerve gets touched like that or entrapped, it will cause, like there's a sign called Laramit's sign, which is an electrical shooting type pain that goes in the arms, and that's when you feel that, or when you hear the patient saying that, you're in your mind, you already know what the problem is. And so when she said the word electrical, she knew it was most likely nerve related, and because of that, instead of just saying it was muscular, we were talking about the muscular contracting, entrapping a nerve, causing the nerve to shoot the pain the way that she's experiencing it, either from the top down or the trigeminal nerve from the bottom up. So you picked up on that, and I know June knows that also. So you picked up on the fact that there are some key words that patients will tell us that will cue us very quickly onto the diagnosis of what's causing the problem. And now we narrowed it from maybe 30 things to 3 things very rapidly, because she was very specific in her description of the pain. Case in point, if somebody says, "Doctor, the only way I get relief is if I take my hand and put it behind my head and just raise my elbow up," 95% chance they've blown a disc in their neck. And so doesn't take much at that point. They need an MRI, and then almost always a disc herniation, and with a high probability of surgery, because of the fact that there's direct pressure on the spinal cord and the nerve, and that's the only way that relieves traction on that. So very good point that you bring up, Larry. Key words, and that's why when somebody comes to the office, we're usually taking 2 histories, not only one, because we want to go over it a second time and make sure that nothing is missed, because that history and listening to the patient, we've pretty much by that point have formulated what the problem is with the patient, and then the examination and x-rays is to confirm our findings or confirm our thoughts in our heads as to what is the true problem.
Yeah, and I know we've talked about before the 1 to 10, the scale of 1 to 10, how painful is it? And my 10 might be Robin's 3, or vice versa, or something like that. So you've got to just use your own intuition, I suppose.
And also look at the patient. You know, if you see that he's a mechanic and he really doesn't sense pain like somebody who may not be, you know, weathered or out or lifting or picking, and you see cuts on him and he doesn't notice them, then his threshold of pain is much higher. Those are the people we worry about. Quite often those you know, stoic people get into an accident and they say, I'm okay, it's just a little sore and I'll get over it, I'm used to soreness. Well, what they're perceiving as soreness to somebody else might be pain that's setting red lights and alarms and sirens off that brings them into the clinic, where this person may not come in until later, and then there might be more damage because of that.
And that's a perfect lead into the car accident new law thing, because if you're that second person, the one who can, you know, grin and bear it,
right?
You're gonna 14 days is gonna go by like nothing,
right?
And you're gonna start to say, well, you know, it's been hurting a while now,
right? And the patients that will be most affected are those patients, the stoic people, you know, the parents, the mom who's more worried about the children than she is herself. And what they do, they put themselves off, or they say, you know, it's really not that bad yet, but a month or 2 later, it doesn't release, it doesn't go away, it starts interfering with their work, or they start dropping things, or their legs might give out a little bit, or they start experiencing numbness and tingling in the arm or leg, at that point, then they come in. But with the prior to January 1st, that wouldn't be a problem if it's related to the accident and no other injuries. But now, since January 1st, if that patient waits to day 15, then they've lost their benefits, and really, that shouldn't be that way, because if something is related to an accident or a trauma, it should fall specific to that insurance. But because of this law, now it allows the personal injury protection insurance not to be available to that person, which means it's going to fall on that person personally or on health insurance, so it will burden the health insurance more.
Getting back to the subtopic that was generated from the first topic with the lady with the tumor, the observation that people seem to be starting to recognize that if they've got something that's aching or painful,
yes,
and they've been relying on aspirin. You know, the person, there was a story the other day that aspirin they believe is contributing to macular degeneration. Mm-hmm. So now, again, another reason to not take an aspirin, and if you have pain, you need to go see a doctor. Right. We do have another phone call. Good morning. You're on the air with Dr. Fakhoury.
Yes, good morning, doctor.
Good morning.
Your field of medicine, how can it help scoliosis in a child?
Oh, wow. That's an excellent question.
We just found out my grandson was diagnosed with it, and other than having wear certain braces and stuff, I believe a chiropractic medication or application would be in line.
Yes. Let's talk a little bit about scoliosis, and at the same time also, call the clinic, leave your number, and let me get more specific information like the degrees, so we could talk a little bit more about the scoliosis. But usually scoliosis is in females, and between 12 to 16 years of age. It usually stops growing, and at the time that puberty sets in, and because the growth slows down. But the scoliosis increases during growth spurts. And what is scoliosis? Scoliosis is curvature of the spine, or the when you see somebody's back and you see that they have a curve in their spine, it's not straight up and down.
Yeah.
There's two types of scoliosis. One we can work with, and the other we can just only support. There's structural and functional. And structural scoliosis is the bad one. That's when we have the patient do the Adams test, which means they're standing in front of us and they bend forward to try and touch their toes.
Yeah.
If the shoulder stays high and if the spine stays caved up on one side and flat on the other, then we have a problem. That's a structural scoliosis. That's called an idiopathic scoliosis, which means there's no known reason for it. They don't know why it happens.
Yeah.
But on certain population, usually females, usually young, as the growth is occurring, they have that curvature occurring. We want to watch it very closely and make sure that it's not getting towards 25, 30, 35 degrees of curvature, and there's different what we call lines of mensuration where we measure the curve.
Mm-hmm.
Then there's the other one that we can work with, which is called a functional scoliosis, not a structural, but functional.
Yeah.
If he or she bends forward at the waist and the curvature goes away and the spine is now straight and the back is level on the right and the left side, then that means that the problem is coming from below, from the pelvis, because when they bend forward, we eliminate the pelvis.
Oh, yeah.
And now it's no longer, the curve is coming from the pelvis, not from that spine.
Yeah.
So what we do in the functional scoliosis, we align the pelvis. One hip is high, one hip is low. It's like standing on the side of a hill. When you stand, your one pelvis is up, one is down, and it causes you to naturally put a curve in your spine. Easy to take care of.
Yeah.
The structural scoliosis, we can help to sometimes slow the process by improving the mechanics, because if there's a curvature that's happening in the spine that's uncontrolled for no reason, and let's say that's 10 degrees, and then on top of it the pelvis is shifted, and that adds 3 or 4 more degrees for a total of 14 degrees. We can work with the pelvis part and keep the alignment there so we don't exacerbate or make the overall curvature worse. So instead of 14 degrees, it might be 10 degrees, because even though we can't work with the structural, we can work with the functional part of the pelvis.
Yeah.
If that's making sense.
You know, every once in a while, you know, like the other day when I was shopping, I seen an elderly woman that was really bent over. And do you think it's a possibility that she had the scoliosis at an early age and it never was helped or corrected, and eventually just kept getting worse and worse and worse?
Usually that's the case. Usually what we want to do is arrest the scoliosis from continuing, and we take X-rays either once every 6 months or once a year, depending on, and then redo those lines of mensuration. How we slow the process down is through good mechanics, good posture, and make sure that they're not crossing their legs, different things of that sort. So we'll work very, very aggressively to try to slow the process down. If it gets to a certain degree, then at that point we're going to recommend the orthopedic brace, which is a 23.5-hour brace, to be able to prevent that spine from continuing. If that doesn't work, then there's the Harrington rods to be able to straighten the spine up mechanically utilizing those rods. So
would your family physician be the first one that would be aware of the situation in a regular checkup?
Yeah, you know, usually the nurse might find it at a school physical. The physician, we have several young children coming through, and we always check them. If a child comes with a mother or father in for treatment, I'll check them right then and there. Almost always the case comes back normal, but if we find one, then we catch it at that point. The chiropractic physician can tag it and watch it. The family care physician can tag it and watch it. The pediatrician can do the same also. The nurse at school might pick it up and then refer that child over to us or to the pediatrician to keep an eye on it. So we monitor it. In our office, we treat it also to try to slow the process down.
Would there be like a family heredity situation there?
Yes, there can very well be, especially on the female side.
On the female side.
So if mom has it or grandma has it, and then what we do is we want to watch the children very closely. Start right about 11. So if we see it starting, we can tag it, and maybe at that point start treating the problem mechanically. What we can help is keep the joints moving and the structural parts so the arthritis doesn't set in. Keep the pelvis lined up. And as you were saying, that lady that you saw in the store, she probably started with the idiopathic scoliosis. It stopped increasing at 17, 18 when puberty set in, because the bone stopped, the growth stopped. But then she probably did not keep up with good mechanics and chiropractic care to keep the spine moving and healthy, keep the pelvis lined up. And over the years, the spine kept shifting 2-3 degrees a year until she's where she's at right now. And then eventually, as you tip to the side, left or right, gravity starts grabbing you, pulling you, and it starts accelerating the process.
I know it was really, to watch her it was hard. She was hanging on to that shopping cart with all her life, so she wouldn't fall over. And I felt so sorry for her. I don't imagine there's anything you can do for a person after that far gone, huh?
Well, at that point, we're just trying to bring mobilization and keep it moving to slow the process down, keep the muscles relaxed. But if somebody is seeing one shoulder higher than the other, or they're getting a pain in the mid-back region on the shoulder blade, or their low back's tight, or they see one hip is higher than the other, those are good candidates to come in and get some treatment and try to keep the joints moving, because arthritis, the scoliosis increases at 2 times in life: during the growth spurt, like we talked about, and then later at 30, 40, 50, 60, when the arthritis starts to set in. And people with scoliosis are more prone to arthritis in the joint because the curve blocks the motion, and where there's lack of motion, then arthritis likes to set in. And what we do as chiropractors is bring motions into those areas that are stuck, so that way slows the arthritis down. And it's just like if you have 2 pieces of metal, if you keep them moving, they won't fuse together.
Okay. Well, thank you very much for your answer.
Oh, the excellent questions. Thank you very much. Bye-bye.
One of the things I thought about in the past is when when my son was going to school, there was a period of time when the school had an issue with contraband, and so they told no more. You can't use your lockers anymore. Without using the lockers, the kids were forced to have all of their books in their backpacks.
Heavy books, yes.
And I used to think this could hurt the back.
And it does. We see more and more children coming in for back pain because of that. And that could accentuate and accelerate the process of scoliosis, especially when it's loose and on one side, and then it drops to the shoulder, and you could sort of mold the spine that way too.
So it could actually cause it, couldn't it?
It can, very much so. And so if you look at the backpacks, they're stretched to the maximum.
Unbelievable.
I know that they're trying to squeeze everything in there.
I know.
And they're heavier than the kids sometimes. You see these little tiny kids carrying a heavy backpack.
Yeah.
Really, a solution should be made for that, because we see more kids coming in now than ever because of pain and structural problems. But you alluded to twice, you were talking about how people now, when they have a problem, they seek out more of conservative management versus going to a surgeon. Do you mind if I touch on that a little bit?
I wanted you to.
Because you brought that up, and to carry on that discussion, it's happening in that patients are naturally realizing that the more conservative and the more natural the approach of care, the healthier it is for them. So in other words, they're not jumping to medications as quickly as they used to. They're not jumping to surgeons like they used to. Before, when I started it 28 years ago, the first person, when you had back pain, the first person you went to was a surgeon. And because of that, surgeries were done more often than they are now, and a lot of them were failures. And so now there's protocols in place where you actually go through stages of care before you work up to the surgeon, hoping that you can stop at one of those stages at the most conservative layer. I call it rungs of a ladder, and you try to stay at the lowest rung. Well, at the Fakhoury Medical and Chiropractic Center, we have medical, we have chiropractic, we have interventional medicine, we have rehab, we have massage, and so that keeps us at the lowest rungs to the middle rungs. So if we can't stabilize that person, we'll refer them on to the surgeon. But what happens is sometimes patients will go to the surgeon and they'll say, "I'm sorry, you didn't try 4 to 6 weeks of conservative treatment at the office," and they'll refer them back to us for physical rehab, massage, and chiropractic, because now there's protocols that they have to follow before going to the surgery. So they have to try a 4 to 6 week course of conservative management, like we do at the Fakhoury Medical and Chiropractic, of the adjustments to mobilize the spine and joints, the rehab to strengthen it, and the massages to relax. If that doesn't work, some light anti-inflammatories, muscle relaxants through Dr. Shanawani. If that doesn't work, interventional medicine, if it's appropriate, by Dr. Hobbs, to do maybe a trigger point or facet block or epidural. And if the person still is having problems or pressure on the nerve that's causing damage, then we'll refer to the surgeon. But by going through the steps, we've been able to save many people from going through surgery. So yes, things have changed now. And not only is there protocol to start more conservatively and build up if you have to,
right.
but patients are naturally, and people are naturally choosing to do that themselves, where they come to us first versus going to the orthopedic surgeon first or the neurosurgeon first, because they want to try a more holistic, natural approach of care.
I would encourage the listeners, if there's the show is called the Head to Toe Care Show. You appropriately named it that because a lot of people think neck, back, chiropractor. They don't think, and wrist. Neck, back, and wrist, I think chiropractor. They don't think about headaches necessarily. They don't think about the jaw that you've mentioned, or the knee. A lot of times, they've got the wrist for the carpal tunnel, the neck, I guess, for the adjustments, and the back. And they're forgetting that you actually can remedy pain anywhere.
The saying is, if it moves, we can work with it. And the jaw moves, and the ankle moves. There was one lady that was having terrific pain in both feet. Lovely lady, good friend of the family. And the first time I saw her, we actually, there's bones in the foot, so we manipulated the bones in the foot from that very first visit. All that pain and suffering she was having with her feet, she came in for her back, but mentioned her feet. But through adjusting the feet, it gave her relief, and that was very important for quality of life, because she couldn't walk, she couldn't go to the store. She couldn't, she was very uncomfortable and couldn't find a comfortable shoe. So just manipulating a very simple mobilization of the feet took care of that problem for her.
And she came in for her back, and she mentioned her feet. So again, communication is ultimately important.
It's the key. It's extremely important. You're exactly right. And if you're unsure if it's something we can take care of, just call the office and come in. You'll be surprised. In cases like with June, with that shooting pain,
right.
It's something that is probably very easy to take care of and something we can address.
And even if you can't describe it as well as she knew how to speak your language. So I'm guessing some people come and go, I don't know, I just got this ache. I don't know how to describe it. I'm guessing then you really have to kind of work with them and do the little question-answer thing, right?
And we question, but then we look to the clues of the body, and we do our orthopedic neurological examination, and through it's almost like a funnel, and as we're getting that information, it helps us to figure out what structure is causing the problem.
Doctor, what is the phone number at your office?
The office number is 351-3413, and extension 4 will take you directly to our patient care coordinator or the front desk. They'll answer any questions that you have, whether it's an insurance question or you want to come into the clinic to get checked out. We'll usually see you that day or the next day, Monday through Saturday.
All right. Thank you for what you do for all of us, Doctor.
Thank you very much, Larry.
You make our lives better. We will take a little break, and we'll be right back.
Accident, injured, hurting. Pain affects so many of us and keeps us from enjoying our daily routine. This is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center. Let me visit with you to answer your questions. Let us help you help yourself on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA. Again, that's Dr. Riadh Fakhoury here to help you on the Head to Toe Care Show every Wednesday, 11 a.m. on WOCA, The Source.
Ocala's information station, 1370 WOCA.
Ocala! They've served our country. They've kept us free. And they need your help.